three goals of behavior analysis as a science. This is the first item on our task list. A1, very beginning. What you want to avoid doing as you're studying for the BCBA exam is skimming past the so-called easy stuff and jumping to the harder stuff. When I do tutoring sessions, a big mistake I see is people have the hard stuff nailed down, but when we get to the basic fundamentals, they start to struggle. We need to be studying everything, okay? Forget about how many questions from each section, blah, blah, blah. That's only going to hurt you. You need to be fluent in everything, even this stuff. So when we talk about the three goals of behavior analysis as a science, what are we talking about? Are we talking about accuracy, validity, and reliability? A. A is talking about data. Good data is accurate. Good data is valid. Good data is reliable. What about B? Determinism, empiricism, and parsimony. These three are philosophical assumptions, okay, that we need to know. However, they're not our three goals of behavior analysis as a science. Determinism, empiricism, and parsimony fall right underneath the three goals, but they're not included in the three goals. C, description, prediction, control. This is what we're looking for. These are our three goals of behavior analysis, okay? We want to be able to describe what we see objectively. We want to form a hypothesis and predict what might happen. And then we want to gain control over our variable that we're trying to manipulate, which is typically a person's behavior. That's our goal of behavior analysis as a science. And then D, prediction, verification, and replication. Those three have to do with single subject design. So you need to know all of these. You need to know what they're related to and what they mean. Again, our three goals are description, prediction, and control. A behavior analyst has been supervising a case for 4 months, but has seen little to no progress. The analyst is extremely frustrated and has doubts that she can help the client given the analyst's current skill set. How should the analyst handle the situation? First off, the analyst is doing a great job at being self-aware and acknowledging some of her faults. And in many cases, you might be better with a certain population, a certain age group, which is totally fine. We need to be able to acknowledge these shortcomings or deficits and, as always, act in the best interest of the client first and foremost. So if the analyst has doubts that she can help the client, she's been working for 4 months, which is a pretty long time with no progress. What should she do? How should she proceed? A, continue with the client for the foreseeable future despite making little to no progress. A, what are we doing? We are trying to run our head into a wall and bust through. We're wasting the client's time. We're wasting our time. Time is precious for our clients. If we're continuing to not make progress, we should not continue down that same road, okay? At least something should change. So A is out. B, create a transition plan for the client and refer the client to another provider. This would be a great option. We're not abandoning the client. We're creating a transition plan. And then we're trying to get the client help elsewhere and we're referring out. B is a very ethical, very smart way to handle a situation like this. What about C? Terminate services with the client as soon as possible in order to not waste any more of the client's time. Sure, we don't want to waste time, but we don't want to just terminate services immediately. What is our rule? We don't abandon clients. Yes, we have seen little to no progress, but maybe we are making little progress, right? So during this transition period, we can still be supporting the client. We should never just abandon the client as soon as we can, though. And then D, attend a year-long training course that targets the client's specific needs. What's wrong with this? What's a year long? A year long is a long time. Is a year of waiting going to be in the best interest of the client? Possibly not, okay? B is just a better answer. This is the answer that serves the best interest of the client without abandoning the client, okay? We're creating a transition plan and then referring out to another provider. We have to consider all these things, okay, as we make goals, as we do needs-based assessments, as we continue treatment. Which of the following is not a possible unwanted effect of reinforcement? First things first, what is this trigger word? Not, okay, not. We have to recognize not. We have to recognize accept. We have to recognize these words, okay? Second thing, what are we looking at? We're looking at reinforcement and the unwanted effects. We need to know the unwanted effects of reinforcement, punishment, and extinction. Well, reinforcement is typically positive, right? We're trying to increase the behavior. We use reinforcement most of the time. That doesn't mean it comes without unwanted effects. So what are some of those unwanted effects? Let's see. A, the learner satiates on the reinforcer. If we're using the same reinforcement over and over again, and the learner satiates on it, what does that mean? It means it's no longer as effective. And that could be a problem if our reinforcers are limited. So an unwanted effect of reinforcement is too much reinforcement to the point where the learner is no longer reinforced by that stimulus. That is an unwanted effect. Remember, we're looking for one that is not an unwanted effect. So let's go to B. There's a decrease in a functionally equivalent behavior that is not receiving the same amount of reinforcement. Absolutely. Okay. So if we have two functionally equivalent behaviors, let's say two responses in a response class, if we're only reinforcing one response, that response is going to tend to go up. Okay. And then these other responses that are functionally equivalent are going to tend to go down. Okay. Think differential reinforcement. If we want both behaviors, right, to increase, we need to reinforce both. So B is an unwanted effect of reinforcement. And then C, unintentionally reinforcing an undesired behavior. Absolutely. This is probably the most common, okay, the most common sense one as well. When we unintentionally reinforce an undesired behavior, we're increasing something we don't want to increase. A, B, and C are all unwanted, and they're all consequences of poor management and poor reinforcement. It leaves us with D, the behavior targeted for increase shows an increasing trend after reinforcement is provided. If our behavior we're targeting is given reinforcement and shows an increasing trend, what does it mean? It means it's going up. Behavior is growing, not an unwanted effect. If we're targeting that behavior and we're providing reinforcement intentionally, that's what we want to see, the behavior increasing. So what is not a possible unwanted effect? D, the behavior targeted for increase shows an increasing trend after reinforcement is provided. During an initial behavior plan training, the BCBA providing the training informs her technicians that she would like imitation targets run at least 10 times per session, and that data should all be taken continuously on target behaviors. What aspect of upholding procedural integrity does this scenario represent? Procedural integrity, we want things done correctly, consistently, and how we write them up. How do we do that? We specify what we want. We train our technicians on what we want them to do, so monitor things like that, or train and model. We monitor their progress, provide supervision ongoing, and then we reinforce, okay, for positive behavior. In this case, what aspect of this four-part plan is the BCBA implementing? What is she doing? Well, she's explaining to the technician exactly what she wants her to do. She wants imitation targets run at least 10 times per session and continuous data. Is she specifying what she wants? Is she training? Is she monitoring? Or is she reinforcing? Well, she's very clearly specifying what she wants. The next step is going to be, okay, here's how we run targets. Here's how we take data continuously. Once training occurs, this BCBA will monitor and make sure the plan is being implemented correctly. And then if it is, we're going to provide some sort of reinforcement to continue that good behavior. So what aspect of upholding procedural integrity does this scenario represent? A, specify. Ethically, we have a responsibility to clients and stakeholders. Stakeholders include who? This is a tricky question without intentionally being a tricky question, okay? Because we always say client when we refer to anyone, refer to parents, teachers, the actual client, everybody is a client. But they make a distinction. We have clients and we have stakeholders. Now, clients are obviously the people getting the services, okay? But then we have stakeholders as well. So what is a stakeholder, okay? Is the stakeholder only the parents of the client? Well, no, the parents, okay, are closer or actually benefiting directly from the services, being the parent of the client, okay? But they're not the only stakeholders, right? What about B? Only the guardians of the client, regardless of parent status. Sure, the guardians would also be stakeholders, but they're not the only stakeholders. Think about the word stakeholder, okay? You have a interest in the outcome of things, okay? If you own stock or you own a stake in a company or an outcome, you have an interest in that outcome. So if you have an interest in this client's outcome, you are a stakeholder, regardless of who you are. So what about the parents, guardians, and team members of the client? Absolutely. These are all stakeholders. But can we do even better? Let's check D. Anyone who has a vested interest in the outcome of the client. Whether you're a parent, guardian, or team member, okay? You might be an out-of-town relative who is very invested in the client, whether you're paying for it or you're just very close, whatever it might be. If you've got a vested interest in the outcome, you are considered a stakeholder. And as practitioners and providers, we serve clients and we serve stakeholders, okay? Anybody who's going to benefit, anybody who has an interest, that's who we serve. So our answer here is D. If you put a behavior on extinction and the client experienced the peak of an extinction burst, what would you expect the behavior to do next? How are we going to attack the question? First, we ask ourselves, what is extinction? Well, we're withholding reinforcement. So we're withholding reinforcement from this behavior. The client is experiencing an extinction burst, which is a temporary, predictable increase in behavior. It's the peak of the extinction burst. So it's the very tip top of that extinction burst. Okay, it's the worst this extinction burst is going to get. What do we think the behavior is going to do next? Why do we say an extinction burst is predictable? Why do we say it's expected? Because we know once the extinction burst stops, once we work through the extinction burst, what tends to happen? Does the behavior A increase? Well, no. If we're at the peak of the extinction burst, okay, that's the tip of the burst. And our knowledge of behavior says what? It says the behavior is about to decrease. So if we have our chart and the extinction burst goes up, 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 and then it peaks, the next thing we can expect is the behavior to start decreasing. If we experience a peak, that's a good sign. Keep going. You can shortly expect the behavior to decrease. The behavior should not stay the same and is not going to immediately stop, even though that's where we're trying to get to. But if we're at the very height, the worst of the worst, okay, the next thing we can expect is that behavior to be decrease. Friday night is board game night for you and your friends. Every week, each of you brings a game. All the games are then placed on the table, and the group decides which one to play first. The game that is picked is removed, and the process continues until all games have been chosen. What type of assessment is this? If we look at the answer choices, which we shouldn't do first, but if you did, it's obviously a preference assessment question. However, you probably figured that out reading the question to begin with. So let's not even worry about the answer choices. Let's attack the question. What type of assessment? That's what we're looking for. That's the question. What's happening in our question? Okay, we're always asking ourselves, what is happening in the question? Friday night, you have a board game. Everybody brings a game. Okay, so you have multiple games. All the games are then placed on the table, and the group decides which one to play first. Okay, so we're picking one at a time. Could this be a single choice? Could this be a multiple stimulus? Well, if all the games are placed on the table, okay, and we're picking from all the stimuli, it's going to be a multiple stimulus because we're not picking one at a time, okay? And we are doing what? Now we have to decide, okay, now is it going to be a multiple stimulus with replacement, without replacement, or maybe a forced choice? Well, if we pick a game and the game that is picked is removed and the process continues, what does that sound like? Well, with forced choice, what do? We present two items. So we would present two games, pick one, present two more games, pick one, on and on and on. In this case, we have our games on the table. A game is picked, it's then removed, pick another game, removed, on and on and on. So this is clearly a multiple stimulus. Is it with replacement or without? It's going to be without, right? With replacement, we would pick a game, put that game back, replace the other stimulus or stimuli. In this case, we're just picking a game, removing it, okay, and then picking again. So what type of assessment is this? It's going to be D, multiple stimulus without replacement. Each staff member is assigned a different task to complete at the end of each day. Once the staff member completes their task, they're free to go home. What type of contingency is at play here? Okay, group contingency question. I think a pretty straightforward group contingency question. What are our different group contingencies? We have a dependent, right, where we're dependent on one or a select group of people, that hero contingency. Independent, each person is responsible for themselves. And then interdependent, the whole group has to complete the contingency. In this case, what is happening? Each staff member is assigned a different task to complete. Once that staff member completes their task, they can go home. Are the staff members reliant on each other, one person, or themselves? Well, they're clearly relying on themselves. Once they complete their task, they can go home. What type of contingency is that? Independent. Group contingencies, not difficult. Okay. Don't miss group contingency questions. These should be layups on the exam. After 3 weeks of data collection and close observation, Susan is not happy with how her RBTs are delivering treatment. She decides she wants to prevent any more poor treatment and develops a plan. What type of strategy is Susan most likely using? What question are we answering? We're answering the question about Susan's strategy and what is happening in the question. Well, Susan has been conducting observation for 3 weeks and is not happy, so she's going to make a change. She wants to prevent any more poor treatment and develops a plan. Well, that's a dead giveaway. Look at A. Is she developing a preventative strategy? Absolutely. Okay. Be careful, right? A preventative strategy, it's the same thing as an antecedent strategy. Okay. Before something can happen, we're trying to prevent it and manipulate the environment, manipulate antecedents. Consequences are reactive, but to be reactive, it has to happen in the moment. If Susan observes and then leaves, develops a plan, comes back 5 days later, that's not reactive. This is now preventative. And that's what she's trying to do. The treatment's not great. She's trying to prevent any further poor treatment. So it is a preventative strategy as well as an antecedent strategy. A consequence strategy is reactive. If in the moment Susan reacted to the poor treatment, that's different. She's not. She's stepping away. She's going to develop a plan. She's going to come back, okay, and try to prevent future poor treatment. What type of strategy is Susan most likely using? Using A, a preventative strategy, and B, an antecedent strategy. Which of the following examples best demonstrates simple discrimination? Okay, what is discrimination? Identifying or telling the difference between two stimuli. Okay, simple as that, right? So let's be careful. We're trying to find an example of us looking at two stimuli and discriminating between those two stimuli, two or more, right? So A, I want cereal. I go to the pantry and grab the only cereal box available. If there's only one cereal box available, do I need to discriminate? Well, not necessarily, right? As long as I can tact cereal, I'm not discriminating between different types of cereal. Okay, there's only one box available. All I need to do is label the cereal box. I can grab it. Okay. What about B? I own one swimsuit and I wear it every time I go swimming. Again, if I own one swimsuit and I wear it every time, am I really discriminating? No, I'm just tacting or labeling my one swimsuit. Okay. There's not multiple swimsuit stimuli that I need to discriminate between. C, I go to the movie ticket counter, look at the different movies, and buy a ticket for Batman. All right. So I've got Batman. I've got another superhero movie. I've got a Pixar movie, and I'm looking through them. Okay. If I'm picking a movie and I need to buy a ticket for Batman, I need to be able to discriminate between the different stimuli, which in this case are the movies. So far, C is the best example of discrimination. And then D, instead of diving in the pool, I do a cannonball. Careful. Are we discriminating between stimuli here, or are we engaging in different responses? What's a different response? Diving versus doing a cannonball is two different things. When we engage in different responses, what are we doing? We're differentiating. Very important. Differential reinforcement leads to discrimination and differentiation. Discrimination has to do with stimuli. Differentiation has to do with responses. Okay. The best example here of discrimination is going to be C. We're discriminating between movies. A lot to unpack in this question. Okay. Make sure you understand this and fully grasp the concept of discrimination and differentiation.